So this is Arthi. It's a great segue from Arthi's striated nephrogram. So this is a follow-up exam. I'm going to withhold history. So pancreas and kidneys, what do you guys think?
Anytime you say pancreas and kidneys together, I'm thinking IGG4. It looks like there's thickening along the left collecting system and maybe like all this heterogeneity in the kidneys. Usually you might see like hypo-enhancing lesions, but they could here, maybe there's like so many of them, they're kind of making it look heterogeneous. So I'm thinking IGG4.
Good. Then the pancreas, we have atrophy. So when we think about atrophy, we think, pancreatic mass. And there is a little bit of fullness in the pancreatic head. But that's not cancer if you look at the old study, because the patient had it in the old study, which was 2 years prior. So here again, we see the wedge shape hypodensities, which look like pyelo, and you want to call it pyelo. And it was like, that was one of the differential diagnoses that was provided. And then the pancreas, there's severe atrophy of the body and tail. So if you look at I was looking at doing the follow-up study, but the patient had a history of IGG4 disease. So there are 5 different patterns associated with IgG4 disease in terms of renal involvement. The most common is what we just saw, which is this like bilateral multifocal wedge shape lesions. This is the most common type. And then you can have diffuse patchy involvement. So you get enlarged bilateral kidneys that are hypodense. And then there are a few other manifestation of renal involvement in the setting of IgG4 disease. This is seen with 1/3 of patients with autoimmune pancreatitis. Here are some examples from this radiographics article. So the first type is what this patient had, which is this multifocal type, which can mimic pyelonephritis. And as I mentioned, that's what it was called initially on the original scan, but we see it again on the follow-up scan 2 years later. And then this is a diffuse type, where you just have like bilateral enlarged kidneys. In these settings, you might think about lymphoma and other DDX. So don't forget to put IgG4 in the DDX. Okay, that's